Greetings, fellow Americans. Welcome to Fireside Chat, State of Our Nation. I am your host, Susanna Tanner, candidate for House of Representatives 2026 and President 2028. Recently, I attended an opponent's community meeting. I went to hear what District 3 constituents were asking and to hear his responses. I listened to his responses and they sounded like the same old beat around the bush political promises that we hear from pretty much all of our elected representatives. Not once did I hear him say no compromise on the Constitution, the people's rights, or the right to life, liberty, and the pursuit of happiness for all. Not once. His responses made me wonder if he's willing to compromise on our rights. That's exactly what our current representative has done, Marie Gluesenkamp-Perez of District 3. Let me make this clear to everyone watching. I will not compromise on the rights of the people. I will not compromise on the right to life, liberty, and the pursuit of happiness for every individual and our nation. And I will not compromise on the Constitution or justice. To do so, in my view, is to betray the American people. I'm not into betrayal. There were two people who responded to me challenging my opponent. I did challenge him to a debate. One constituent said, well, you just guaranteed that I won't vote for you. My question is why? Because I challenged an opponent in front of constituents? If challenging an opponent is not what you want in a fight for constituents, what is? If you want passive representation, that's great. I'm not passive. I'm taking action. I am showing that I am willing to fight for District 3, for the rights of District 3, for the upgrades for District 3, and for the life, liberty, and pursuit of happiness of District 3. I really don't see that as bad. The second constituent simply stated, I don't like your use of AI. Why? How is it hurting anyone? If you don't like AI for yourself, that's great. If someone does not want their candidate to use AI to get information out, that is their right. That causes me to wonder, though, if people who feel that way really want someone to fight for them. I am doing things the way that I believe a candidate should in a fight for the people. I will use the tools available to me to get the information to the public. I want someone who's going to fight for us, really fight for us. And I'm not talking about compromising on our rights. I'm not talking about someone who's willing or not willing to compromise on their morals. I want someone to represent us who is not willing to compromise on the right to life, liberty, and the pursuit of happiness for our district, our state, and the people of the nation. If you don't want that, that's okay. You don't have to vote for me. Keep in mind, though, I am providing solutions to our nation's issues, solutions to our district's issues, solutions to Vancouver, Washington's issues. Solutions, not compromises. We have the opportunity as a people, as a district, to say we've had enough and we are ready for these solutions. So let's lift our district up, and in doing so, lift our nation up. Some food for thought. Now let's talk about the universal health care system. We're going to talk about the scope of the coverage and the core philosophy. And the core philosophy is, if it betters your health, betters your way of life, then it's likely going to be covered. So the UHC system establishes a universal health care benefit package, the National Health Care Benefits Package. that covers all necessary medical services for every citizen with zero premiums, zero deductibles, and zero out-of-pocket costs for essential and preventative services or care. This means everything you will medically need to improve your quality of life is covered. Foundational rights and patient autonomy is important. Each individual retains the right to decide on their own health procedures. The government cannot compel a citizen to undergo any medical treatment. Mandatory vaccines is an example, or threaten job loss for noncompliance. We did see that happen during the COVID pandemic. The government must also be truthful and provide truthful, transparent, and accurate information regarding all public health matters. Failure to abide by this can and has in the past resulted in the deaths of American citizens. Think COVID pandemic. It's the most recent one that's happened. Now, there are some exclusions, and there is a clarification on the elective procedures. The universal healthcare system will not cover procedures determined to be purely cosmetic or experimental without established clinical efficacy. SSC. It's a weird word. Any procedure required to treat a diagnosed medical or psychological condition to restore normal body function or to alleviate documented severe emotional distress shall be deemed medically necessary and fully covered. Procedures whose primary purpose is aesthetic enhancement and which do not meet the medically necessary definition, such as liposuction or lifts, anything like that, breast augmentation, not related to post-cancer reconstruction, are excluded. All doctor visits, psychological consultations, and preparatory care leading up to the procedure, regardless of final coverage determination, are fully covered under mental health services and specialist and outpatient care. Now, this means that maybe eye surgery would help improve your quality of life by allowing you to see better. This would be covered. So would at least one pair of glasses per year and a set of contacts for those who prefer them. It also means dental care is covered, including implants. Teeth improve the ability to take in different types of sustenance, which we all need in order for our bodies to function. So specialists in healthcare are covered in this new system. It is time that we all were able to get healthcare, that we're all able to get the healthcare that we need for our nation. Now, the Secure America Infrastructure and Services Act is how we pay for it. We pay the tax that is appropriate to our income level. So if you were making $75,000 a year, it would be 5.5% for the national tax. And it goes into the Universal Healthcare Lockbox. Lockbox 2. It covers the expense of your healthcare, and your portion is covered. The lockbox pays hospitals and medical facilities and services for salaries, supplies, medical rides, and upgrades. Universal health care for a healthier America. That is all I have for today. Thank you for your time, and may our path lead to peace and prosperity.